Are you looking for the best sciatica sleeping position? Or maybe you have sciatica and you're struggling to sleep and you're trying to find a position that's comfortable because you know if you're not sleeping, you're not healing, and you're struggling to be able to get the quality sleep that you need at night due to your sciatica pain. Then you're in luck, because today's video is for you. Today we're going to be discussing the best positions to sleep with sciatica, the positions that you need to avoid, and what you can do to improve the quality of your sleep. If you're suffering with sciatica pain, you know that it's really hard to find a comfortable position and be able to get the sleep you need. But if you're not sleeping, then you get more tired and more irritable, which makes your pain perception higher, and it just becomes this really negative spiral. So finding a comfortable sleeping position is one of the most important things that you can do if you're suffering with sciatica symptoms. So that's why we decided to talk about this today. First thing, I want to start by talking about your mattress and your pillow. Now, the perfect mattress is difficult to find. So many people often ask me, what mattress should I do? Should I this one, that one? There's all these brand names. There's so many different mattresses out there right now. What I can tell you is the firmer, the better, especially if you're struggling with sciatica symptoms. It's really important to have that support in your back. In fact, some people who are struggling with sciatica actually prefer to sleep on the floor because they're looking for something that is super, super firm and supportive. I'm not saying you have to go sleep on the floor, but that could definitely be an option. But what I am saying is you need to have a firm mattress. Now, if you really struggle with laying on a firm mattress, I recommend either getting like a pillow top mattress so you've got some softness there, or like a mattress topper that you can change out over time if it starts to break down. In fact, I've had many patients who have gotten a really, really firm mattress and then they're able to flip it and rotate it because it doesn't have the pillow top, and then they just switch out the mattress topper, which honestly is probably a great idea to be able to get your mattress to last for a long period of time. Point being, you need to have a firm mattress, but put something on top of it if it bothers like your hips or your bony areas to lay on it for long periods of time. Now, if you have a really not great mattress and you're struggling with sciatica symptoms and you're like, I need something I can do right now, and going mattress shopping is just beyond my capabilities, here's what I want you to do. I want you to get a piece of plywood and I want you to put it in between your mattress and your box spring. That's going to help give your mattress some more support for right now. It may not be the best long-term answer, especially if you've got some broken springs or something like that. If your mattress is really broken down and indented, it's not the best long-term option, but it's a great short-term option. So putting a piece of plywood in between the mattress and the box spring can really help to increase the firmness. Now, if that's not an option for you and your mattress is just no good, then the floor is going to be your next best option for right now. The firmness of the floor actually can make things feel really, really good. In fact, I've had some patients come in and actually tell me that they started sleeping on the floor on their own because that was just what felt the most comfortable, and it worked for them. So honestly, your body's going to tell you, but if it is telling you to get out of your bed, then find another option for right now. And please, please, please do not make that option your couch. I know so many people feel like it feels more comfortable when I'm on the couch, and I understand that in the short term, but in the long term, the couch does not have the support you need for your low back, and it is definitely going to increase your sciatica symptoms. The couch is really not a good option for sleeping ever, but it definitely is not a good option for sleeping if you're having sciatica symptoms. Worst case scenario, put a yoga mat down on the floor and lay on that. That's going to be way better for you than the couch. Now, the second thing is you need to have a good pillow. Now, I did a whole series of pillow reviews and we'll link those down below, but I have found a new pillow that is my new favorite that I'm going to share with you today. The thing is, you need to find the pillow that works best for you. Now, I am primarily a side sleeper, and what I found is the Pillow-Wise pillow. And the reason why I like this is because it has this support that fills in this hole here, and then your head rests in a really neutral position. So you'll see in a minute when I lay down on my side that my head is really, really supported in a good position. However, you'll also see when I lay down on my back that my head is still supported in a good position. So that's why I'm a big fan of the PillowWise pillows, but really what I want is for you to find the best support for your neck and shoulders. We want to make sure that we're not compromising one part of our body in order to bring relief to another part of our body. So it's really important that you have a good pillow that works for you and works for your head and works for your neck and shoulders. So what you're looking for is when you get out of bed in the morning, you should feel no tension in your neck or shoulders or anything like that, okay? It should just feel like comfortable. Yeah, I got a good night's sleep and I don't feel really tense or stressed or anything like that. I was actually feeling that way before with some previous pillows that I had been using, and that's when I found the PillowWise pillow, and it's been a huge game changer for me. I was actually waking up with headaches, and the PillowWise pillow has improved that. So find a good pillow for you. This is important because if your neck and shoulders are really tight, which happens when we get pain, right? We start to have pain and we feel like, oh, everything's really tight in there. Then you definitely want to make sure that you've got a good pillow to support your neck and shoulders. All right, so we've talked about the bed, we've talked about the pillow. Now let's talk about the sleeping positions. Sleeping position number 1. Many people find it most comfortable when they have sciatica symptoms to sleep on their side. Now, this will be more for you if you're someone who feels like when I'm sitting, I'm more comfortable. Maybe even if I bend forward slightly, I'm more comfortable. You may find when you're going shopping that like you kind of want to lean on the cart a little bit. If that's you and you kind of feel better in a more forward bent position a little bit, then probably the side sleeping position is going to be for you. So here's what that's going to look like. Now, in the side lying position, what I want is for, again, that head and neck to be supported with a comfortable pillow. So making sure that you're not, bent up this way or bent down that way or something like that. So finding that neck in a neutral position. And then I also want you to have a pillow in between your knees. This helps to keep your hips stacked, which takes some pressure off of your low back. So it's helpful, especially when you're struggling with sciatica, although you can do this anytime and it's going to help make things feel better. It's also going to keep you from getting in this position where one leg's crossed over the other. When you do this, that puts a lot of rotation through your back, which if your back's feeling fine, it's not really a problem. I don't really have a problem with it, but if you have sciatica, obviously your back's not feeling fine, so then I do have a problem with it. So, pillow between your knees, keeping your hips in a nice stacked position is going to make things feel much, much better. And then find a comfortable place for this top arm, either down by your side. You can kind of have it resting here. You can have another pillow in front of you to kind of hold on to it to keep your neck and shoulders nice and relaxed. Whatever feels good for that shoulder is fine, but make sure that there's a pillow between your knees and a pillow underneath your head to support your neck and shoulders. Now, how much should your knees be flexed up or straight? That's a matter of comfort. So again, this is supposed to be a comfortable position. If you're in pain, it's going to be really difficult to sleep. So make sure you're in a comfortable position. That knee flexion or that knee bend can change based on what feels best for you. Either way is fine as long as you feel comfortable. Let's talk about the next position. Now, if you're someone who finds relief from your sciatica symptoms more when you're standing up straight, more when you're in that really tall position, you may find it more comfortable to be sleeping on your back. Again, we want to make sure we have a nice comfortable pillow that's supporting our neck and shoulders. Now this time we want to put a pillow rolled up underneath our knees. If you have a small roll or bolster, you could also use that. You don't have to use anything too big, although if it feels more comfortable to use something bigger, that's absolutely fine. We want to make sure that the knees are a little bit elevated because that helps to unlock the hamstrings, which decreases the pull on the ilium. So the ilium are these hip bones here, and they attach to the sacrum, which is your tailbone, which is right in the center, which obviously your spine lines up on. So we want to decrease stress through the hamstring, which decreases stress through the ilium, the sacrum, and therefore the low back. That's why that's so important, but you don't have to have it super bent up. Although, again, if it feels more comfortable and that puts you in a more comfortable position so you can sleep, then go ahead and do as much knee bend as you need, because the whole point of this is that you're in a comfortable position and you can actually get some sleep. Now, next we're going to talk about the one position that I need you to avoid. Now, the one position that I really need you to avoid if you're struggling with sciatica, actually just the one position that I really need you to avoid in general, is laying on your stomach. Laying on your stomach is no good because even when you're down here, you still have increased force through your low back, okay? It's not going to be great for your sciatica. It's going to increase your symptoms and cause problems. It's definitely not the position we want you to be in. In addition to that, when you're laying on your stomach, you're putting a lot of torque through your neck. Everybody I know who's a stomach sleeper ends up having neck pain later on in life. So if you're young and you're like, oh, I'm fine, I don't have any neck pain yet. I know, but let me tell you, I'm gonna see you when you're in your 40s, 50s, and 60s, and you're gonna be telling me, oh yeah, I've been sleeping on my stomach my whole entire life. I get it. You gotta break that habit. Stomach sleeping is no good for your neck and shoulders. It's not great for your sciatica symptoms either, so let's just go ahead and break it now. Let's get into a more comfortable position and retrain your body to be able to sleep in a better way for your entire body. So that way I don't see you for your neck and shoulders in a couple years. Now, before we go, I need to debunk a myth that I've been hearing a lot on the internet, and it's really, really relevant for what we're talking about today. The last thing I want to talk about is please do not take a hot pack to bed with you if you have sciatica pain. Friends, I cannot stress this point enough. Heat is the worst thing you can do for your sciatica. The reason why is that it will increase blood flow to the area, but probably the reason why you're having these symptoms is because you have an inflamed area anyway. When an area becomes inflamed and you increase the blood flow, it doesn't clean it out. It causes a stagnant area, which is just going to increase the irritation around that nerve and increase your symptoms. And I understand that it does cause some muscle relaxation, so it makes things feel better in the short term, but it doesn't do you any good in the long term. What I recommend instead is using ice. You only need to use it for 3 to 5 minutes, but it is going to, 1, decrease your pain initially when you use it, but 2, start bringing some healing to that area because it decreases the inflammation overall. So it's really important, and if you really struggle with getting comfortable when you get into bed, if you really start to feel like I can't find a good position, it really hurts to lay down, one thing you can do is take an ice pack to bed with you. And I know it seems really weird. I definitely would recommend like one of the gel ones, not like, you know, one of the ice ones, right? Like that's probably not a good idea. But if you have one of the gel ones and you're laying on it or you drape it over your back while you're on your side, 1, it can help decrease your pain so you can actually fall asleep. And then 2, if you wake up and, you know, it's not icy anymore, right? Because hopefully it's been a couple hours, you've gotten a couple REM cycles going on, just throw it on the floor, leave it there, and then you can go take care of it in the morning, put it back in the freezer. I understand you can't do that with ice, right? It might drip everywhere. I get it. Definitely for a gel pack for that one. But I want you to be using ice. I want you to take an ice pack to bed with you to make sure that you're getting the maximum amount of healing every single night. It is super important to decrease the irritation or the inflammation around that nerve so that it can actually heal and stop bothering you. Now that you're sleeping better with your sciatica symptoms, you should be feeling better in about 7 days. Not necessarily full relief of your symptoms, but you should notice a significant change that things are feeling better and you're not having as much pain. It's not being as aggravated. Although sciatica can take more than 7 days to heal, definitely within those first 7 days, you should notice a pretty significant improvement and a decrease in symptoms. If you're still struggling, even though you're getting a good night's sleep, then I'd like you to watch this video where we talk about the best things you can do to help your sciatica pain. Have a great day, everyone.